Hey rehabbers, welcome to Rehab Review. How important is body position when you're doing your rehabilitation exercises? Today we're checking out a really interesting article from South Korea which looks at how body position can affect muscle activation in a really common rehab exercise. So let's go. If you're new here, welcome. My name is Tom. I'm your physio today, and this is Rehab Review, where we check out research relating to physiotherapy and rehabilitation. Okay, so this study is by Kang et al. It's from 2012 in South Korea in the Journal of Manual Therapy. I'm not sure why it's in that journal because it doesn't have any manual therapy in it. And in this study, they looked at how different degrees of hip abduction affected EMG activity in hamstrings and glute in a really common exercise, this prone hip extension with the knee bent. So this is a pretty common exercise that a lot of physios will give to their patients in the early rehab phase. The reason I picked this study is because this is a really useful exercise that can be done at home, doesn't require any equipment. And of course, glutes and hamstrings are two of the key muscles that we target when we're doing our rehabilitation programs for the lower back, for the hip, for the knee, the ankle. And I really love these studies which do a deep dive into what is actually happening in our rehab exercises and what little tweaks we can make to make them more specific to our patients. You can also do it with the knee straight or bent, though it's thought that if you bend the knee, you're going to bias the glutes more if that's your target muscle. So they took 30 healthy subjects with the average age of 22.8 years, and the stated purpose of their study was to look at the effect of hip abduction position on glute max and hamstring activity. They put their subjects lying on the ground with these wooden guides to help keep them in the correct angle, and then they test them at 0, 15, and 30 degrees of hip abduction, using EMG to look at the muscle activation in the glute med and the hamstring for all three of those positions. Okay, so let's look at the really interesting results from this study. So this first graph shows off the EMG activity of the glute max at 0, 15, and 30 degrees. You can see there's this steady increase with the most activation at 30 degrees. Now this kind of makes sense if you think about the orientation of glute max fibers, which are directed obliquely downward and lateral as they attach in. So you can see how with a hip abduction angle of 30 degrees, these fibers are going to be more perpendicular to the bone that they're pulling on, as opposed to 0 degrees when there's going to be a bit more of an angle on that line of pull. On the flip side, if we look at the hamstrings, we can see the opposite, where at 0, 15, and 30, there's a decreasing amount of hamstring activity. Of course, these results were significant, as were the ones before. And again, this makes sense when we look at the line of pull of the hamstring muscles. In that 0 abduction angle, they have a more perpendicular insertion, which gives them a mechanical advantage. Finally, we can look at muscle onset time. So this is looking at which muscle fires quickest. So basically, what is the body most inclined to use? And we can see that the body's not stupid. At 0 degrees, it's using the hamstring more. At 15 degrees, it's using both quite equally. And then at 30 degrees, it's using glute max more. So the brain is using the muscle that is at the greatest mechanical advantage at that angle, which makes sense from an efficiency point of view. Interestingly, the author's perception of this muscle firing was that glute max fires first at 30 degrees as it needs to maintain the hip abduction that is created. I have to admit that wasn't my perception, but interesting to see that different viewpoint. Okay, so let's get to the review part. Why did I like this study and what can we learn from it? I really love this research that does a deeper dive into our rehabilitation exercises. Often we're told this exercise targets this muscle and that's it. So I like it when we actually get confirmation about the EMG activity, and something as simple as this, that just changing the angle can change which muscle is biased. In this case, increasing hip abduction angle favors glute max over hamstrings. If you've got a patient who you really want to focus on training that specific muscle, you know that you can change the hip abduction angle and you're going to get a little bit more bias of that target muscle. On the flip side, let's say you have a patient who has a hamstring tear and you want to work it a little bit less, you can put the hip into that abduction angle to get less hamstring activation and more help from the glute med in the early stages, and then slowly bring the angle back to 0 when you want to load that hamstring more. So something as simple as just changing the hip abduction angle can help you progress through your rehab. Another really interesting point that I like about this article is that it emphasizes the importance of fiber orientation, which is also something I don't hear people talking about too much, but it does make sense. Obviously, when a muscle is inserting into a bone at a perpendicular, it's going to have a stronger mechanical advantage. And that's something we might need to think about with all muscles around the body. This is why knowing origin and insertion of muscles is so important, because that's going to show you the connecting line that lets you determine what is its angle of pull. So this is something now in the future I'm going to be thinking about a lot more, trying to apply my anatomy into, okay, what angle could I put at just to bias a certain muscle a little bit more over another one. Now in this study, they only checked those 3 positions, but based on this gradual increase or decrease, we can assume that's probably on a spectrum. Now, I don't know what the limitations are. For example, when you go past 30 degrees, is there a point where that curve starts to go down and you get less glute max activity? So there are a couple of limitations to the study, but I think the key point is considering body position, lines of pull in your rehabilitation to get the best effect. I also like how it gives some added emphasis to why learning insertions and origins is so important, because when we're in university, we learn them. It does feel quite laborious learning them all. And sometimes I think it's not explained fully why we're doing that. When you see how the direction of fibers affects muscle activity so much, it helps justify more why we need to know origins and insertions, and it incentivizes that learning as well. Another slightly interesting thing about this study in the exclusion criteria is that they excluded anyone who had a positive Ober's or Thomas test. In case you don't know, those are muscle length tests for the hip. I've never seen anyone use those as exclusion criteria. I thought that was very interesting. If you've ever seen another study that does that, please leave me a comment down below. Obviously, we commonly see people excluded for previous injuries or ongoing treatment, etc. But for positive muscle length test, that's a first for me. Okay, so that's what I thought about this really interesting study from South Korea. What did you think? Leave me a comment down below. Are there any really interesting research articles that you want me to check out? And make sure that you're subscribed so that you don't miss that video when it comes out. Of course, drop me a like as well, and I hope to see you in another rehab review very, very soon.